I'm Kristal. Yeah, I did radiography at Monash Uni. I work as a radiographer at the Austin Hospital in Heidelberg, and I also do some teaching at Monash Uni as well. So I've got a bit of both going on at the moment. Yeah, it's great. You work with people all the time, so you have new patients coming in and out of your work, and then you also get to work in a team environment, so with other doctors and nurses and other radiographers. So I think the team environment's really good. You work together with people. And it's really you're not by yourself doing things. And then I really like working with patients as well. It's really rewarding for them to say to you, hey, thanks, I really appreciate you being so kind to me. That really makes you feel good. So a radiographer is someone who takes x-rays is one thing, but then they do lots of other things as well. So you might be involved in ultrasound, you could be a sonographer, or you could do MRI or CT, for example. So they're all different sorts of things, and we even do some procedures, so with doctors taking x-rays as we do theatre or those sorts of things. Yeah, so a radiographers, they're the ones that are in there with the patient. They're the ones that actually take the x-rays or do the scans, and then the radiologists are the ones that report the films afterwards. So I think we have the much better job because we get to actually be in there and have fun with the scanning and, you know, get to hang out with patients, that sort of thing. Yeah, so a radiographer is like a healthcare professional, like a physio or someone like that. It's a 3 to 4 year degree, whereas a radiologist, you do medicine and then you study radiology afterwards. I really enjoy the variety. So not just doing x-rays all day, doing lots of different parts of radiography, as I said before. And I really enjoy working with people. So I've come to realise that I'm quite a social person and I don't want to sit in an office. It's really not a desk job at all, and that's what I really love about it. You get to be out there and do things with your hands and meet people and talk to people. You can work in like a more private practice, which is good if you want more of a 9 to 5 sort of job, but the more interesting, fun sort of part of radiography is in a hospital. Yeah, so come in the morning. Sometimes we would do like a round within the hospital, so go to ICU and do some x-rays, standard x-rays in the day. Then you'd be rostered to an area. So say I'd be rostered to CT for the day. So that's where you do, it's where you do a scan of the body, a region, and the patient goes in and out of the machine and you end up with a 3D picture of the patient. So it's pretty cool. Patients can be a bit sicker because they're a more high-end scan, but you're able to, they're still all right, and you're able to produce some good images and get some good diagnostic outcomes for them. Yeah, so you need to be someone who enjoys people and enjoy communicating with people. Even though, it is a science-based course, you are interacting with patients and other people in the hospital. So that's a really important thing, and I think you need to enjoy that as well to enjoy your job. And then in terms of being at school, you need to keep up with your maths. And then at the moment, to get into radiography, you either need to do physics or biology. But physics is kind of the main one because I know that may change and it has changed in the past. So yeah, doing physics is important. You don't have to be great at physics, but having that background is helpful because the theory of radiation and stuff is physics-based, so you need to learn about that at school. Well, I love x-rays. I find them really interesting. I find it fascinating the way that I think I'm so privileged to be able to work with people and in a job where I get to see the x-rays myself, and I always find that really interesting and find pathologies and stuff interesting. So I really enjoy that, and I really enjoy being able to have a positive influence on patients. So it makes me feel really good when they can say thank you, that really made my day, or made this thing that I was worried about really not that bad. Think about something that you like to do in terms of, like, I was interested in the health science, and then give something a go, and you may like it or you may not, and it's all right if you don't like it, but you may find that you really enjoy it. But if it's something that you think, I could enjoy that, I knew that I wanted to do a health science, but I had no idea which one, and I chose radiography. It was kind of one of those things, but in actual fact, I think I would have been happy if I'd chosen any of them. I don't think it really would have mattered for me, but just finding the area that I liked and then investigating that. Don't feel like I'm not 100% sure that that's what I want to do. And so then you step back and don't do it at all. Give it a go, it's all right. Yeah, for me, coming into radiography, I really thought that I didn't really know a whole lot of what it was about. I'd read some stuff and I'd had an X-ray, I'd had an ultrasound before, but I really didn't know that there was a lot more involved. And the surprising thing for me was the real delight that, wow, there's so much more and it's really interesting. There's all these different areas I could end up working in. And even for me, doing teaching as well as clinical work has been really good. So the delight and the surprise was having the variety and the scope that, wow, this involves a lot more than what I had expected. So it's really easy to go overseas. So a lot of people go to the UK, for example, Ireland, England, and work as a radiographer there. Also, you can become a rep for a company. So people do that. So then they go travelling around Australia, teaching people how to work the X-ray machines for the different companies, that sort of thing. And then you can also, travel within Australia easily. And you can get involved in teaching as well. And then pretty much all hospitals have a tutor position. So you can work 100% clinically, but you're the one there that mentors the students and helps them out as well. And then there's also managerial positions that you can do.